Hello, my name is Nick. I'm just doing the discussion post for our class regarding a chronic pain patient that I've worked with. One that comes to mind is a patient that I worked with on our most recent rotation. I'll call him Jeff. But so his evaluation, he came in with bilateral ankle osteoarthritis, with the left being more painful than the right, typically. Um, But along with that diagnosis, he's also been juggling a whole bunch of different health issues. He recently underwent cancer treatment. Um, he had some kidney issues. There's a bunch of other things that he was dealing with that conflicted with obviously the ankle pain that he gets. And he does have, so I forgot also, he has diagnosed with rheumatoid arthritis. So a lot of his joints flare up with pain um, just throughout the day. And the main reason why I brought up the chemotherapy was because he shared with us that his cortisol levels were highly effective. So if he does too much activity or does too many things um, during that on time of his medication, he says he experiences a huge crash after the fact, and then is completely just pretty much incapacitated for the rest of the day, if not longer. So there's definitely like a lot of balancing that he had to do, especially if he wanted to treat the ankle osteoarthritis, which was he was coming in for to see us for. Um, so yeah, as you can already tell, just with the brief overview of his case, there were a lot of things that we had to consider when making his exercise program, and just making sure that what we were doing in the clinic wasn't too much for him. So that way, either like ruined the rest of his day, or if we prescribed him to do things, that's what I actually found working with him is that we found a good exercise plan. He reacted well in the clinic. However, when he would try to do it at that regular volume that we would prescribe, like for the home exercise program, which would be 4 to 5 times weekly, once a day, um, we found that it was a little too much for him. And after the first week, he would come back and like, oh, like I feel good in the moment, but as soon as I get done, like I experience that crash, and it resets me all the way back, and I feel my pain once again. Um, so it wasn't like he was like blaming us or anything. It was just something that we have to work through. He was very compliant. He was a great patient to work with. It's just, especially as like a new clinician, it was hard to kind of juggle that because I want to do exercises with him and I want to do the things that work for him. But of course, there's going to be that juggling effect that we always have to deal with as well because he's working and he's doing a whole lot of things. Like he can't just devote his time to exercising and getting stronger and then crashing out completely afterwards because his cortisol levels are low, or just energy levels are low in general. Um, One thing wish I had known before working with him, and I guess I kind of learned it as I was working with him, was essentially that management of the comorbidities. I definitely had a lot of talks with my CI regarding that and like how to adjust things moving forward. Um, but yeah, like kind of being mindful of that and adjusting my own treatment strategies based on that is something I definitely wish I would have known before. But I mean, it's also good because I'm a student, so learning it with him was perfectly fine too.